Physicians have always been encouraged by the medical community to offer their patients a trial of healthy lifestyle changes as the first step to therapy when they are dealing with high blood pressure, prediabetes, early heart disease, and especially elevated cholesterol. However, most physicians give this recommendation lip service as they write a prescription for their patients. Why is this? Well, most physicians believe that their patients will not be able to make these lifestyle changes, and even if they did, they would not be clinically effective. However, it is also much easier to write a prescription than to help and motivate your patients to make lifestyle changes. So most physicians simply go ahead and write their prescriptions. However, I have always believed that physicians should use medications as a last resort and not a first choice. Therefore, many of our patients could avoid the risk of taking medications altogether, or at least be less dependent on medications if they firmly establish healthy, effective lifestyles. The next time you see an advertisement for a statin drug on TV, listen very carefully, because they will always make the statement, when diet and exercise have failed, then consider using their drug. Why do they make that statement? Well, it is because statin drugs have only been approved as second-step therapy by the FDA. First-step therapy should be a trial of healthy lifestyles, such as diet and exercise, as a way to lower your cholesterol level instead of using drugs. The main reason is the fact that taking any drug has its risk. In fact, statin drugs have been shown to cause muscle pain and weakness, and in some cases, fatal muscle damage. As statin drugs block the production of cholesterol in the liver, they also block the production of a very important nutrient called coenzyme Q10, which is critical for our overall health. Therefore, it is essential that if anyone is taking a statin drug or decides to take a statin drug, they should also take CoQ10 in supplementation to compensate for this significant side effect. However, the most concerning problem with taking a statin drug is just now becoming known. Recent studies have shown that statin drugs actually increase your blood sugars, creating a problem called hyperglycemia. This elevated blood sugar in your bloodstream actually increases your risk of having a heart attack. This has created a significant dilemma for physicians who freely prescribe statin drugs. Now they're going to have to consider even more carefully the risk of taking a drug versus the benefit to their patients to whom they are considering prescribing a statin drug. I believe that the Healthy for Life program is the ideal first step to therapy. In the Healthy for Life program, we promote a triad of healthy lifestyles, which is a healthy diet that contains those good, low glycemic carbohydrates, those good fats, and good proteins, along with a modest, consistent exercise program and nutritional supplementation. This online behavioral modification program has now been involved in 3 separate clinical trials under the direction and guidelines of the FDA. Each 90-day clinical trial has shown that patients lower their total cholesterol by 17%, their LDL cholesterol by 19%, and their triglyceride levels, that's the other fat in the blood, by 27%. Their blood pressure actually drops 10 points on each side, and their blood sugars decrease, and they significantly improve insulin sensitivity as they all lose between 13 and 15 pounds from around their middle. These clinical improvements continue to get even better and better over time as these individuals firmly establish these new, healthier lifestyles and continue them throughout their lives. Therefore, if you are being told you need to be taking a statin drug or a high blood pressure medication or a pill for your diabetes, you should consider a trial of healthy lifestyles as your first step to therapy. Consider checking out the Healthy for Life program located at healthconceptsint.com.